Hi everyone, my name is Dan, I'm a veterinarian, and today we're going to talk about hip dysplasia. What it is, how I medically manage it, and when and if is surgery needed. If these pet health videos have been helpful for you, please go ahead and subscribe and like. Hip dysplasia is hereditary. I see hip dysplasia in all ages. That's because it's not like arthritis or degenerative joint disease that becomes progressive over time, that gets worse with inflammation. Hip dysplasia is a bad hip. If you have your ball and your socket and they go together like this, hip dysplasia may mean a shallow socket doesn't hold it like it should. It may mean a poorly formed ball joint. Either way, when the dog goes to walk, that socket doesn't slide, it grinds or it pops. And because of the joint instability, you develop arthritis or degenerative joint disease in conjunction with your hip dysplasia. Some hip dysplasia is really mild at first. So it's just some poor alignment maybe, or it's a shallow socket, or maybe the ball joint isn't perfectly rounded. And the dog starts off okay, but as they age, they get more arthritis and degenerative joint disease because hey, it's unstable and it's not perfect. As it progresses in life, the dog gets more and more painful as they get to middle age. And then I get some doggies that have such bad hips, maybe even at 6 months or 9 months, they're already painful and limping on them. So hip dysplasia can affect all ages. We do see it more commonly in our large breed dogs compared to our toy breeds. That is why a lot of breeders will do hip dysplasia screening tests. Well, they'll take an x-ray and we will send it off to a radiologist or a specialist in x-rays, and they will review it for us and they'll give us a report. And if mom and dad's hips look good, we can feel confident to make more puppies of that mom and dad. If the hips are questionable, there's a good chance the puppies will have bad hips too. And we'll just keep passing the hip dysplasia down the line. For mild cases of hip dysplasia, I will do medical management. That includes joint supplements. It also includes maintaining a healthy body weight so we have less pressure in the joints. And when it starts to get more progressive, I will start an anti-inflammatory, which reduces inflammation in the hips, so hopefully we can get around better and feel better. In the really bad cases, we'll do surgery. Surgery entails something called an FHO, or femoral head osteectomy. We have that ball and socket, right everybody? And we're just going to cut that ball off so it no longer makes contact with the socket. So it's no longer grinding when the doggy walks. It forms a false joint, so we walk, there's no more pain. And there's so much muscle body development over those hips in a dog that supports the hip, and they can live a very pain-free life compared to before. It is considered a salvage procedure. So if we're going to do it, it really needs to be appropriate and we shouldn't rush into it. That's why medical management is always a good first step before going to the scalpel blade. The other option is a total hip, where they go in and replace the hip with an implant. This procedure is far more expensive, but it can be a really good option as well. A majority of dogs are managed with medical management and never need surgery.